Greetings everyone, welcome to Dr. Nguyyen's YouTube channel. Today we dive into the world of monkeypox. Monkeypox, a rare and sometimes deadly disease, was first discovered in the forests of Central and West Africa. It's a cousin of the infamous smallpox, but don't worry, it's not as deadly. However, it's important to understand this disease, how it presents itself, how it is diagnosed and treated, and most importantly, how we can prevent it. Stay tuned as we delve deeper into this fascinating topic. Monkeypox, a rare disease, has its roots in Central and West Africa. This might seem like a far-off concern, but this illness, first discovered in monkeys, has made a leap into the human population. It's a member of the orthopox virus family, which includes the now eradicated smallpox. Monkeypox is a zoonotic disease, meaning it can jump from animals to humans. The primary hosts are small mammals, but humans can contract the virus through direct contact with an infected animal's blood, bodily fluids, or cutaneous or mucosal lesions. In humans, monkeypox presents a significant health concern. It can cause severe illness, and in rare cases, it can be fatal. The impact on human health is particularly acute in regions with limited access to healthcare, or where people live in close proximity to animals. The transmission process is also worth noting. Human-to-human transmission, while less common, can occur through respiratory droplets, direct contact with skin lesions of an infected person, or contaminated materials. Understanding monkeypox requires us to look at the symptoms it causes. Let's move on to that. Symptoms are our body's way of signaling something is off. With monkeypox, these signs can be quite telling. The initial signs of monkeypox might seem similar to the flu. A person may experience fever, headache, muscle aches, back pain, or chills. This is often accompanied by a general feeling of discomfort or malaise, but don't be fooled, these symptoms are just the beginning. About 1 to 3 days after the fever starts, the individual may develop a rash. This rash typically begins on the face and then spreads to other parts of the body. The rash changes and goes through different stages before finally forming a scab, which later falls off. It's important to note that monkeypox is similar to human smallpox, though it is usually a milder illness. The rash might look like that of smallpox, but the progression is different. Another key symptom is swollen lymph nodes. This is usually one of the first signs of monkeypox. If you notice a swelling in your lymph nodes, especially in combination with any of the other symptoms we've discussed, it's essential to seek medical attention promptly. Recognizing these symptoms early is paramount. Monkeypox is a serious, potentially life-threatening disease, but with early detection and proper care, the prognosis can be significantly improved. Identifying these symptoms is the first step. Diagnosing monkeypox is the next critical stage. Diagnosis is the key to effective treatment. With monkeypox, it's no different. Monkeypox, a rare viral disease similar to human smallpox, can be tricky to diagnose. Why? Because its early symptoms mimic other common illnesses like chickenpox. However, distinguishing monkeypox from other diseases is crucial for the appropriate treatment and prevention of further spread. So, how do doctors diagnose monkeypox? The process involves a combination of physical examination and laboratory testing. During the physical examination, doctors typically look for the telltale signs of monkeypox, which include a rash that often begins on the face and then spreads to other parts of the body. But physical examination alone isn't enough. To confirm a monkeypox diagnosis, doctors rely on laboratory tests. The most common of these tests is polymerase chain reaction, or PCR, which can detect the monkeypox virus in the blood, skin lesions, or other body fluids. But here's the thing. Timing is crucial. These tests are most effective when performed within the first few days of the disease, when the virus is most abundant in the body. Why is diagnosis so important? Because it's the first step towards appropriate treatment. It also helps in taking necessary precautions to prevent the spread of this contagious disease. So, remember, if you or someone you know exhibits symptoms that seem like monkeypox, seek medical attention immediately. Early diagnosis could be the difference between a swift recovery and severe complications. Once diagnosed, the next step is treatment. Treatment is where the battle against monkeypox truly begins. When it comes to tackling this disease, it's important to understand that there's no specific treatment available yet. However, that doesn't mean we're left defenseless. Supportive care is the cornerstone of managing monkeypox. This involves easing the symptoms and making the patient as comfortable as possible. Things like hydration, nutrition, and pain management can make a significant difference in the patient's journey towards recovery. At times, severe cases might require more intense care, such as hospitalization. This is to ensure that complications like bacterial infections or severe dehydration can be promptly addressed. While there's no specific antiviral medication for monkeypox, some drugs used for similar viruses have shown promise. These are typically administered under the care of a medical professional and under specific circumstances. In the end, it's important to remember that treatment is not just about medication. It's about providing a comprehensive approach to care, which includes psychological support. After all, dealing with monkeypox can be a stressful experience, and emotional well-being plays a crucial role in recovery. Despite the challenges, the medical community is tirelessly working on finding more effective treatments. As we continue to learn more about monkeypox, our arsenal against it is bound to grow. While treatment is vital, prevention can be even more important. Prevention, they say, is better than cure. This holds true for monkeypox as well. To prevent monkeypox, one of the most effective measures is to avoid contact with animals that might carry the virus. This includes avoiding areas where such animals are found, particularly in Central and West Africa, where outbreaks are most common. It's also wise to avoid consuming bushmeat or any undercooked meat which might be contaminated. In addition, practicing good hygiene can play a significant role in prevention. Regular hand washing, particularly after contact with animals or people who might be infected, is crucial. It's also essential to avoid close contact with anyone suspected of having monkeypox, as the virus can spread from person to person through respiratory droplets. Now, if you're in a region experiencing a monkeypox outbreak, it's advisable to get vaccinated. Although there isn't a dedicated monkeypox vaccine, the smallpox vaccine has been proven to be about 85% effective in preventing monkeypox. But what happens if monkeypox is left untreated? Well, complications can arise. Most people recover from monkeypox within a few weeks, but severe and sometimes life-threatening complications can occur, especially in people with weakened immune systems. These complications can include secondary infections, pneumonia, and in rare cases, even death. Moreover, monkeypox can leave lasting marks on the body. It's not uncommon for survivors to have significant scarring, particularly on the face, which is often a source of social stigma. While monkeypox is generally self-limiting and most people recover without treatment, it's essential to seek medical advice if you suspect you've been exposed to the virus. Early diagnosis and care can significantly reduce the risk of complications and help manage the symptoms more effectively. Remember, monkeypox, like many diseases, can be prevented with awareness and basic preventive measures. So let's stay informed, practice good hygiene, and avoid unnecessary risks. Prevention helps avoid complications, ensuring we stay healthy. As we wrap up, let's revisit the key points about monkeypox. We've taken a journey through the world of this rare yet significant disease, starting with an overview that highlighted its origin and how it's transmitted. We then delved into the symptoms, which range from mild fever to severe rash, emphasizing the importance of early detection. The journey continued with the diagnosis process, underscored by the critical role of medical professionals and laboratory testing. We explored treatment options, reminding everyone that while there's no specific treatment for monkeypox, supportive care can greatly help manage symptoms. Lastly, we discussed prevention methods like good hygiene practices and avoiding contact with infected animals or humans. We also touched upon potential complications, underlining the gravity of this disease. Monkeypox may be rare, but knowledge is our best defense. Understanding its aspects can help us respond effectively should the need arise. Thank you for joining us today on Dr. Nguyen's YouTube channel. Stay informed, stay healthy,